Welcome everyone, I am absolutely thrilled to have you here for this explainer. Today we're diving into the fascinating and honestly rapidly evolving science of kidney health. And look, I want you to go ahead and forget everything you thought you knew about these vital organs, because recent medical breakthroughs, they are completely rewriting the rulebook. We're going to cover the whole shebang today, from how your gut bacteria can actually influence cellular energy, right up to how our kidneys might literally be able to regenerate themselves.
So, let's kick things off with a question that, well, it might sound a little bizarre at first. Can a common constipation drug save your kidneys? I know, it sounds like total science fiction, right? But I promise you, this totally unexpected question sits right at the center of this incredible medical mystery we're about to unravel.
But before we get to the solution, we really need to understand the sheer scale of the problem we're dealing with. 800 million, that is the number of people worldwide currently affected by chronic kidney disease, or CKD. It's a massive, staggering global crisis, and as the disease progresses, so many of these patients eventually require dialysis just to survive.
Section 1. The silent kidney crisis.
To really wrap our heads around why that 800 million number is so incredibly high, we have to recognize that this health burden doesn't just exist in a vacuum. 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure may actually have chronic kidney disease. Because these underlying conditions are just so common globally, they drastically increase the risk of CKD for a huge portion of the population. So this matters to almost everyone watching. Even if you don't personally have kidney issues, chances are for sure that you or someone you love is managing diabetes or high blood pressure.
Section 2. Acute versus chronic damage.
Now, to really grasp how we treat kidney issues, we need to understand the two main types of damage. First, we have acute kidney injury, or AKI. This happens super suddenly. We're talking over hours or days, usually from things like severe dehydration or a bad infection. The kidneys stay their normal size, and crucially, this is often totally reversible. But then, on the flip side, we have chronic kidney disease. This is a gradual onset, lasting more than 3 months. It leads to progressive scarring, the kidneys actually shrink in size, and historically, well, it's always been viewed as an irreversible one-way street.
When a sudden injury does happen, doctors use something called the KDIGO staging criteria to measure just how bad it is. They're basically looking at 2 main things: increases in serum creatinine, which is just a waste product in your blood, and your urine output. Recognizing these markers at stage 1 is absolutely vital. Why? Because taking swift action to fix that dehydration or infection early on is the key to stopping a temporary injury from snowballing into permanent, long-term CKD.
Section 3. The gut-kidney connection.
Okay, this brings us to a major, mind-blowing pivot in our explainer. We are introducing an unexpected hero in the fight against kidney failure. Remember that bizarre question I asked at the beginning? Well, researchers at Tohoku University in Japan noticed something interesting. They saw that CKD patients often suffer from constipation, which throws off their gut microbiome and actually makes their kidney function worse. So, they worked backward. They took 150 patients with moderate CKD and gave them an approved constipation medication called lubiprostone. And the results? They were stunning. Treating the gut actually slowed down the decline of the patient's kidney function.
Let's break down exactly how this builds into a fascinating chain reaction, because how on earth does a gut drug help the kidneys? Here's how it works. Step 1, the patient takes the constipation drug. Step 2, this totally remodels their gut microbiome. Step 3, these newly altered gut bacteria crank up the production of a natural compound called spermidine. And step 4, this is the magic part, that spermidine acts like a physical shield for your mitochondria. Those are the little power plants inside your cells. It protects the kidney tissue from taking any further damage. It's just this incredible biological domino effect.
And the data from this 24-week trial shows a really clear dose-dependent benefit. The placebo group, they showed the standard decline you'd expect. The 8 microgram dose group showed medium preservation, but the 16 microgram dose group showed high preservation of their kidney function. This proves undeniably the strength of the gut-kidney axis. By simply fixing the gut, we are literally preserving the kidney.
Section 4. The regeneration revelation.
But hey, what if we could go beyond just preserving whatever's left? We are about to shatter a massive, long-held medical myth today, the idea that adult kidneys are completely static organs. For decades, we all thought that once your kidneys were fully formed, well, that was it. Game over. But paradigm-shifting research out of Stanford University reveals that adult kidneys actually continuously grow and remodel themselves. They do this through a highly specific cellular signaling pathway called Wnt. These slightly specialized stem cells, hanging out in different segments of the kidney, can actually give rise to brand new cells and generate fresh tissue throughout your entire life.
Dr. Benjamin Deckel, who is a senior author of the study, gives us this profound visual metaphor to understand it. He says it's like a tree with branches in which each branch takes care of its own growth instead of being dependent on the trunk. Take a second to really digest that. The kidney isn't just relying on one central master pool of stem cells. Localized regeneration is happening all over the place, all across the kidney's architecture.
However, there is a catch. When kidneys are injured, they don't always regenerate perfectly. Sometimes they scar, and a massive breakthrough from a UCLA study identified exactly why some people scar so much worse than others. They found that a specific gene, the COL5A1 gene, which produces type 5 collagen, is the critical predictor of severe kidney scarring, which doctors call fibrosis. A lack of this specific collagen leads to weak, disorganized tissue that triggers this vicious cycle of excessive scarring and ultimately kidney failure. To make this a bit easier to visualize, Dr. Arjun Deb from UCLA explains it like this. Type 5 collagen ensures the fabric of a scar is not woven haphazardly, that it is instead structured and stable. It's just like threads holding a piece of fabric together. Those structured collagen threads keep the kidney from totally overreacting and overscarring when it's just trying to heal itself. And guys, here is the incredibly exciting news. That same UCLA team found that a repurposed anti-cancer drug, a drug called silingidide, can actually block the cellular signals that cause all this overscarring. Meaning, by using a simple blood test to measure type 5 collagen, doctors might very soon have a precision medicine approach. They'll be able to identify high-risk patients and give them this targeted therapy to stop kidney fibrosis dead in its tracks.
Section 5. Managing Kidney Health Today.
Okay, while regenerative medicine and these anti-scarring drugs are definitely the thrilling future, let's bring the science back down to grounded reality for a second. What are doctors and patients doing right now? The absolute crucial point I want you to take away today is this. While we wait for those regenerative cures to hit the clinics, true structural reversal of CKD is still very rare. However, and this is a big however, the functional progression of the disease can be aggressively slowed down. Current therapies are incredibly successful at focusing on preserving the kidney function you still have and stopping that decline. The CDC has some highly effective, totally actionable lifestyle guidelines to help protect whatever kidney function remains. First, you've got to quit smoking, mainly because it directly messes with your blood pressure meds. You need to engage in regular physical activity that boosts your energy and your heart health. You absolutely must manage your diabetes targets, and you need to strictly keep your blood pressure below 140/90. I know these sound super basic, but trust me, they are your absolute frontline defense. And let's talk about food for a minute, because a CKD-friendly diet absolutely does not have to be bland and boring. There are so many delicious options: lean poultry and fish, fresh berries, cauliflower, eggplant. But the most critical takeaway here, you have to limit your sodium to less than 2 grams a day. That is super important. Get creative with herbs and spices instead of reaching for the salt shaker, and I promise your kidneys will thank you.
On the medical side of things, the standard of care has evolved dramatically. First-line clinical pharmacotherapy now strongly recommends a really comprehensive multi-drug approach. Using things called SGLT2 inhibitors and RAS inhibitors together directly addresses protein leaking into the urine, which is a condition known as proteinuria. Reducing this protein leakage drastically, and I mean drastically, reduces the risk of reaching end-stage kidney failure and needing dialysis. We have covered some truly incredible ground today, from treating our gut to build a shield for our kidneys, all the way to uncovering those hidden regenerative branches deep inside our organs. So, as we wrap up this explainer, I want to leave you with one final thought to chew on. As science learns to heal our vital organs through our gut bacteria and cellular branches, how will you rethink your body's longevity today? Thank you so much for joining me. Stay curious and keep learning.